Good afternoon, everyone, and welcome to our bi-weekly COVID-19 update that we have for the community. Thank you for joining us. My name is Melanie Jones, and I am a health educator for the Lake Cumberland District Health Department. And today joining me is Amy Tomlinson, the Executive Director for the Lake Cumberland District Health Department, Dr. Wayman, our Medical Director, and Brian from IT. And so we just thank you all for joining in with us today. COVID-19 numbers continue to increase across our district, and we wanted to be available to answer any questions from the community that you may have. And so I just wanted to start with Amy, if you had any updates that you would like to share with us before we start.
Thanks, Melanie. I'm just going to give you all a quick summary, and I'm going to share my screen if I'm able to do that. Let me try. See if this is going to work for me. Okay, you all should be seeing the case summary. Can you see that, Melanie? Okay, so this is our case summary as of last night. You can see that across the district, our total number of active cases is 994, which is actually down somewhat from where we have been over the last few weeks. So that's encouraging. We have a total of 558 deaths. We've had a total of 32,810 cases across the district for the duration of this pandemic. So that's a lot of sick people over the last 18, 19, 20 months or so. Yesterday we had a gain of 345 cases total, and of those, I don't have the numbers right in front of me, but if I'm remembering correctly, it was right around 88 to 89, 90% somewhere unvaccinated in that number, and then another, I think it was 33% or so of those were 18 and under. So we are definitely still, seeing a lot of sickness out there. Our hospitals are still reporting that they're at capacity. Our ICU beds are still very much in demand across our region, and we are still having to transfer patients out for care for some of our more seriously ill patients. So that is concerning still. We have a lot of people on ventilators. EMS still has the strike team here. That's in place until the end of the month, I believe. So everything we talked about last time, I guess, on this is still kind of in place for us here at the district. I'm also going to share my screen one more time and try to show you all if this will work. Hold on just a second. Maybe it won't. Let me see if I can do something. I wanted to show you that we are actually, as of last week, we look like we may be at a peak or nearing a peak. It's hard to tell because last week was a holiday. We had a Labor Day weekend in there. So reporting very well and very likely may be delayed on some labs and things that we're seeing. So I don't know that we can definitively say just yet that we have peaked or are declining, but it's hopeful, that maybe we are starting to see that trend. The state has said as much also on their numbers that I've seen. So let me see if I can share this now. I think I've got it set up. Share screen. This should work. Hopefully you all are seeing our trend chart. And you can see this is our number of cases, for each week over the history of the pandemic. Our highest point ever was the week of 9/4. That was just before Labor Day. And it was 101.93. Last week's number was 82.53. So you can see it was slightly down, but like I said, it's just cautious optimism that maybe that they're starting to see, a plateauing or a leveling off. It's too early to tell for sure. We will need to see what this week's numbers include. And I always like to remind you that this decreased number right here is because we don't have a full week's worth of data yet. So this is not a complete number. This won't be accurate until Saturday or Friday night or Saturday of this week. So this number very well will end up more like somewhere in this range or higher when we see what's going on. So I will show you, if I can show one more thing, let me see. We have some new tools at our disposal, and I wanted to share with you all in case you want to track things like this also. There is a vaccination webpage. You can go to, I think the web address is kycovid19.ky.gov. That's what this page is. And if you click on vaccine right here at the top, it will bring you up to the vaccine page, and you can find the closest vaccine to you. If you want to search by your zip code or by your address, you can find a vaccine. If you're looking for where to go to get a particular kind of vaccine, you can search by the brand, the type of vaccine. If you want Moderna or Pfizer or Johnson & Johnson, you can search by that, as well as your address, and see where the providers are that's closest to you. But the thing that I wanted to point out to you is this view dashboard. If you click on that link, hopefully it's going to open up. Are you seeing the map of Kentucky now, Melanie? Okay. So this has all been updated this week or within this past week or so. And so you can click on any of these counties and hover over them, and it will give you the vaccination rates for the county, and it will have some information on demographics. So what of those, how many of those are over 18 years of age? How many are over 65? That kind of thing. So that is very good information. And I am extremely happy to report that all of our counties are increasing in their vaccination rates. It has been a slow process. It's been a percentage point or a half a percentage point or something at a time, but we are actually increasing. And every little bit is going to help. So this information is all readily available here on this webpage too. And I just want to make sure that everyone has that so they can watch. Other than that, we'll go over toward the end of this. If you don't mind, Melanie, I will share a screen again toward the end about quarantine guidance, and we'll go over the 10-10-10 recommendations and how long you should quarantine and all of those kinds of things. But I'll let you go ahead and get into the questions.
All right, thank you. And so we do have some questions today. And if you think of a question that you would like to ask, you can type it into the chat box there on the YouTube page, and we will try to get to that. And so our first question is, how long can a positive COVID case test positive?
Okay, so the PCR test, which is possibly the most common, can be positive for weeks and maybe even months. However, this is not necessarily a viable virus. It is the remnant RNA from the virus that can still show positivity. The antigen test, however, tends to be negative once the person recovers.
Okay, thank you. The next question is, my 10-year-old daughter has COVID right now. She's gradually losing her sense of taste and smell, and she can smell and taste some things and not all things. Is this common?
Yes, it is quite common. In fact, there are at present no other diseases that cause loss of taste and smell. And so if somebody has that, we pretty much feel confident that they have COVID.
Okay, thank you. The next question is, I watch your email every day and have noted that a pretty large handful of individuals have died who were vaccinated. Why is that?
Well, first of all, it's not as many as you think, approximately maybe 10% or less. But in the last month, we have seen quite a few persons who've been vaccinated pass from COVID. It's been around 5 out of 28. All of them were either elderly and or had underlying conditions. Waning immunity is also a problem since most of the elderly had their vaccination early on in the year, so it's been many months. And to start with, the elderly also have weaker immune systems, so that when they get vaccinated, they may not mount as good an immune response as the young do.
And all of that, Dr. Wayman, is what points to the need for booster doses, which has been in the news lately. Can you hear me?
I can, but I didn't catch the beginning.
I said all of that is sort of pointing to the need for booster doses,
Yes.
which is what we've been talking about, a potential third dose coming for some additional immunocompromised situations, and then a boost dose for those who received the early vaccinations.
Yes, so the immunocompromised are already asked to get a third dose, whereas the rest of us are still waiting for directions from the CDC.
Okay. The next question is, explain the difference between isolation and quarantine.
Well, in reality, they're really very similar. Both require a person to stay away from other people. Isolation is designated for people who are cases, so that they stay away and do not spread the disease. And quarantine is designated for people who've been exposed and maybe brewing the disease and could also spread it. So that way we prevent spread of COVID. Both
Okay,
of them are 10 days.
All right, thank you. And the next question is, when should I expect a call from the health department after testing positive?
Well, since we've had many cases and limited staff, you may not receive a call from us for several days. However, all the instructions for isolation and care are on our website immediately as you log on to the LCDHD.org.
Okay, thank you. The next question is, when can someone get the booster shot? And if a person had taken Moderna in the past, can they take Pfizer as their booster?
So as yet, the FDA has not given us specifics as to when the booster doses will be authorized. And currently they recommend the use of the same vaccine that you had the first time round for your third dose if you happen to be immunocompromised. And those folks can get that now. The third dose is given to immunocompromised persons at this time.
Okay, and then the last question is, I tested positive for COVID. Should I get retested after my 10 days of isolation?
No, you should not get retested as long as you're recovering well. As I said earlier, the PCR test may be positive still, so that doesn't help you. And many studies have shown that you are no longer contagious, providing you're recovering and afebrile. That is, you don't have a fever. And it's been at least 10 days.
Okay, thank you, Dr. Wayman. And that was the end of the questions that we had submitted previously.
I think there has been one question that I see on our YouTube Live also, Melanie, so let me throw that one out there and I will attempt to answer that. The question is, will LCDHD have the ability to mandate or strongly recommend masks for schools, and will we? And I think most people are aware that the legislature that met in special session last week, and the bill that came out of that and the final outcomes of that session was that local school boards now have the authority to set their own COVID policies and plans, and to do their own masking recommendations. So I know that a lot of schools are debating this now, and a lot of school boards are talking about what they need to be doing. We at Lake Cumberland District Health Department issued a letter earlier this week to all the school boards stating our stand on it and encouraging them very strongly to continue masking at this point in time. Due to the fact that all of our counties are currently in the red zone, and not just barely into the red zone, but well into the red zone. With the exception of Clinton County, if you're looking at the state map, they are somehow orange, and it's because the state is behind on reporting for all of our counties. So according to our own local numbers that we keep on our own webpage, all of our counties are well into the red zone. So because of that, and because of the demands on the hospital and the staffing and the situations that we're seeing across our counties, and due to the fact that children 12 and under do not yet have an option for a vaccine, we still recommend masking, especially in classroom settings, indoors, on buses, that kind of thing. So yes, a communication did go out this week from the health department recommending that to school boards. And I know that they are meeting this week to determine locally what they're going to do. They have the option now to, what they're going to decide, but we have taken a stand that we encourage and recommend masking. So that was the only question that I see, Melanie. So let me share my screen one more time, and I will go over with you all the guidance on quarantine and isolation. So hopefully you all should be seeing this 10-10-10 graphic. And this is basically just a very simple visual for everyone that can answer the question, what do you do if you have been exposed to or tested positive for COVID-19? So the first two are if you have tested positive. So this first 10 is if you've tested positive for COVID-19 and you have symptoms. The recommendation is to isolate for 10 days, and that's 10 days from the date the symptoms began. So it may be, you may start feeling bad on Saturday, but you don't go to the doctor or get a test or anything until Tuesday. So your 10 days would begin on Saturday when your symptoms began. The second 10 is if you have tested positive for COVID-19 and you have no symptoms. So you're asymptomatic. And a lot of times these are found through surveillance testing. You're just doing some sort of random test, like a lot of healthcare workers have to test routinely for their job. A lot of pre-op stuff may still be requiring a test if you're going to have a procedure or anything. So if that's the case and you have no symptoms, but you have tested positive, you are still to isolate yourself for 10 days. And that would be from the date you had the test done, because we wouldn't have a symptom onset for that. And this last 10 is the recommendation for quarantine if you are unvaccinated and have been in close contact with someone diagnosed with COVID-19. So that would be a quarantine for 10 days from your last exposure to that positive COVID-19 case. And then there's a asterisk there next to the quarantine. And I always want to tell you all, the quarantine option is that you can shorten that to 7 days if you have no symptoms and you have a negative test on day 5, 6, or 7. So day 5 or after, you can come out of quarantine on the 7th day. And that is, that's just standard across the state. This is the recommended days, length of durations, and that kind of thing that we're looking at. And then some businesses have different policies on certain things, and it will depend on your employer. But if you are fully vaccinated and you have a contact with a COVID positive person, there is no recommendation to quarantine. You can continue going about your business. However, it is recommended that you consider getting a test between days 3 and 5, just in case you're asymptomatic. So that would be the alternative there. Sorry, I had to unshare.
All right. Thank you, Amy. Was there anything else that you wanted to share, or you were finished?
I think I'm finished. I just wanted to thank everyone for tuning into these briefs. As I shared earlier, the trend, I don't want anyone to take this and make this be your headline that we're seeing a decrease in cases, because I don't know that that's true. I think that that's just a cautious optimism on my part, that I'm looking at it and trying to see some bright spot in all of this. I do want you all to consider that we need to look at this week's data for sure before we see where we're going. Consider that the health department is still behind on getting cases worked and contacted and all of that, so that will affect our numbers. And it's just way too early to definitively say that we're on a downturn of this. So continue taking your precautions, washing your hands, social distancing, wearing your mask, and please consider getting a vaccination if you haven't done so. That is truly the long-term way out of this problem that we're seeing in the pandemic, is to everybody get vaccinated.
All right, thank you. And I just want to remind everyone again that they can check our website for a lot of different data and information that they may need, LCDHD.org. And then if you would like to submit a question for our updates to be answered, you can send that through the website or through our social media pages. Our next community update will be September the 29th at 2:00 Eastern Time, 1:00 Central Time. And we also send out daily updates Monday through Friday, and you can find those on our website as well. And so thank you again for joining us today, and have a great and safe day.